Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
A new patient presents for evaluation of self-diagnosed bipolar disorder. An assessment of her history of interpersonal relationships increases your index of suspicion for borderline personality disorder as opposed to bipolar disorder. Which of the following circumstances is most characteristic of borderline personality disorder? A, her fluctuations in mood have caused problems with interpersonal relationships at work. B, both parents have expressed significant concern over the depths of her mood when she is depressed. C, the history reveals that relationships with significant others always seem to be very tumultuous. Or D, she is resistant to treatment because when her mood is good, she is very productive. And so, again, make sure you answer what the question is asking of you. The question is, which of the following circumstances is most characteristic of borderline personality disorder? So that's what you're looking for here. This is not an unusual scenario. In the social media instant information age, patients will very often get online, Google their symptoms, and come up with a diagnosis. Or they'll see a TikTok video or some other social medium. Someone will post a video and say, these things were happening to me and I was diagnosed with this and I took this med and it really helps. And for any number of reasons, people land in your office with their own diagnosis and often a suggestion about how to best treat it. And listen, sometimes patients will bring you very good information. A very intelligent patient will do a good dig and find good stuff and bring it to you. So, I don't mean to sound dismissive of that. Over the years, I have certainly learned some good things from patients bringing me good information. However, we are the professionals and they are the lay people. And so when they bring to us a self-diagnosis or information that they found, their own research, we are the professional who evaluates it in context with what we know about the disorder, our own experience and knowledge base, etc. And so apparently, from what I understand from my younger patients, it's cool to be bipolar, but it is not cool to have borderline personality disorder. And so because everyone sees things through their own lenses, when they identify some of these extremes of personality and people tell them that something's wrong and they should check it out, when they go online, apparently bipolar disorder is more appealing. Not only is it, I guess, cool, but it is also treatable with medication, which we know borderline personality is not. So when you have this patient in front of you, one of the important things that you will evaluate is the history of relationships. Borderline personality and bipolar disorder, you know that these things are fairly easy to tell apart when you know what you're looking for, when you know how to make the appropriate assessment. And this is clearly an assessment question. So when you look at these four answer choices, again, the question for you very specifically is, which of the following circumstances is most characteristic of borderline personality disorder? What is most characteristic? And the answer is C. Tumultuous dramatic relationships are a key feature. They are a cardinal feature of the borderline personality disorder. Not so much with bipolar disorder. It certainly can happen depending on the extremes of the poles and the rapidity of cycling. I don't mean to imply that bipolar disorder may not interfere with relationships in the bipolar patient. But if we have to pick the answer choice that is most characteristic or most suggestive of the borderline personality, it is these tumultuous interpersonal relationships because they are almost always there. As you start to do your assessment of the patient with a borderline personality, one of the key things you will find is that you go back to their relationships. Very often intimate partner relationships are characterized by extremes between there's fighting and breaking up, and they're a horrible person. And then the makeups are, they're the best ever. Everything is euphoric and it's perfect until it's not again. And even with family members, friends, people at work, I mean, the intimate partner relationships aren't the only relationships that can suffer, but it's the tumultuous characteristic that makes C the best answer. Fluctuations in mood have caused problems with elucidated in the relationship. That's choice A. Certainly, mania and hypomania, or for that matter, profound depression, can cause problems at work, but C remains the best answer. Sometimes an element of mania actually makes things better for people at work. They do tend to be very productive. Similarly, the depressive bipolar disorder may be very profound and disturbing to family member. People with borderline personality typically don't experience true major depressive episodes, a true 5 of 9 classic domains depressive episodes. The patient with the borderline personality tends to fluctuate between, highly erratic and just more irritable and angry. And so A, B, and even D, she is resistant to treatment because when her mood is good, she is very productive. That is very characteristic of the manic patient. The borderline personality who is experiencing what he or she would call their elevated or manic mood really isn't manic, and they don't typically engage in purposeful behavior, and they don't get anything done. In fact, they often just, stir things up and really make things more dramatic or difficult in their life. And so it certainly isn't a case where C is right and A, B, and D are wrong. This is a case where C is the best answer to this question. Could be A. And I mean, listen, even B, the borderline patient may demonstrate some symptoms of depression that are concerning to the parent. D really is not characteristic of the borderline personality. They do not tend to be productive. But you could talk yourself into A and B if you overthought it. But the bottom line is C is the best answer to this question because A or B really could go either way. But C is clearly the circumstance or the characteristic of borderline personality disorder that is most likely. As always, you want to be sure to answer precisely what is asked of you and pick the best answer of those provided. Even if you might like a few choices, one will be best.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.